Hello, my name is Tim Rodriguez, and I am a P4 pharmacy student at the University of Connecticut, working with Dr. Jennifer Gerardo in the development of a blog review on watchful waiting in acute otitis media. You can find this blog post on the UConn School of Pharmacy and Pharmaceutical Sciences website under the Pediatric Infectious Diseases and Immunization Update blog series. Acute otitis media, or AOM, is very common in younger children, with most experiencing at least one episode by the time they are 3 years old. It is important to recognize that AOM is self-limiting, and the majority of non-severe infections resolve on their own within a week without any antibiotics. Today, I am highlighting the topic of watchful waiting. It involves observing the patient for 48 to 72 hours before starting any antibiotics. The caregiver then has the option to request antibiotics if their child's symptoms are not improving or are worsening. This approach takes advantage of an opportunity to avoid unnecessary antibiotics, while still maintaining a safe and effective treatment option. Due to parent skepticism, we must educate each other on where watchful waiting fits into AOM therapy, the evidence supporting it, and how pharmacists can help. With respect to the American Academy of Pediatrics guidelines, watchful waiting is appropriate in children 6 to 23 months with non-severe unilateral AOM, or those 24 months and older with unilateral or bilateral AOM. In both of these groups, they need to present with non-severe symptoms in order to be candidates for watchful waiting. So mild ear pain for less than 48 hours and no fever over 102.2 Fahrenheit. Watchful waiting is also not indicated in those with otorrhea or discharge from the ear. It is important to note that regardless of a patient receiving any antibiotics, the AAP guidelines always recommend pain management. Antibiotics are not expected to resolve symptoms of fever or ear pain within the first 24 hours, so counseling on the proper dosing of over-the-counter antipyretics or analgesics will be an impactful way pharmacists can help in the management of AOM. When comparing immediate antibiotic use to watchful waiting in AOM, there is no difference in parent satisfaction. In outcomes such as recurrence rates, need for additional doses, or failure rates by days 3 through 14 were similar between the two groups. Despite this, immediate antibiotics are still used in non-severe AOM the majority of the time. There is small benefit to using antibiotic therapy, as there are fewer days of school or work missed in this group, as well as a lower need for analgesic doses. However, these benefits are only modest symptomatic resolutions, as antibiotics are not expected to work within the first 24 hours anyways. What may help parents and caregivers consider trying watchful waiting for non-severe AOM are the associated risks and increased adverse effects with antibiotics. Children taking antibiotics for non-severe AOM were at greater risk of having antibiotic resistance to one or more medications. And there are higher costs associated with immediate antibiotics, as patients will be taking a prescription from day one. By delaying antibiotic use, we can still have effective cure rates, parent satisfaction, and the benefits of a safer and less expensive treatment option. Considering these factors together in the setting of non-severe AOM, we should favor and encourage watchful waiting. Evidence supports that increased usage of watchful waiting could also significantly reduce antibiotic exposure, with estimates suggesting nearly a 20% reduction in total antibiotic days. Despite this projection, it remains underutilized in practice. Multiple strategies have been shown to improve its use by incorporating different methods at the point of care in emergency rooms, doctor's offices, and in the electronic health record. These include safety net prescriptions, where families are given an antibiotic prescription but are instructed to wait before filling it unless symptoms persist. Decision aids and educational tools also help caregivers better understand treatment options and feel more confident in delaying antibiotics. The decision aids, such as the one provided above, help caregivers be informed about the benefits and risks of both immediate antibiotics and watchful waiting, depending on the clinical presentation of their child. Additionally, system-level approaches like electronic health record prompts and standardized templates help providers apply guidelines more consistently. These data suggest prescribers are more likely to diagnose and identify non-severe AOM patients eligible for watchful waiting. Together, these relatively simple interventions improve shared decision-making and reduce the amount of unnecessary antibiotic use. Pharmacists have an important role in supporting the use of watchful waiting. This includes helping caregivers recognize appropriate symptoms and ensuring proper triage when referral is needed. Pharmacists also play a key role in optimizing pain management and reinforcing education around when antibiotics are or are not necessary. By supporting shared decision-making and promoting appropriate use of antibiotics, pharmacists contribute directly to antimicrobial stewardship and improved patient care. Ultimately, watchful waiting isn't about doing less. Pharmacists should be aware of the process of watchful waiting and provide education to parents and reinforce the rationale why providers may recommend watchful waiting for their child. Helping each other recognize eligible patients and educate on the benefits of watchful waiting will result in greater adherence to the AAP guidelines that support watchful waiting. Thank you for watching. The full blog post and article can be found by following the link on the screen. If you found this video interesting, please be sure to like, follow, and subscribe to our channel. And check out our blog for more pediatric infectious disease and immunization updates. Have a great rest of your day.